Pancreatic cancer is relatively a rare cancer. In the United States, about 35,000 patients get diagnosed with this disease every year. And it does have a high mortality rate, and usually the mortality rate is about 32,000 per year. And in the recent years, we have made some advances in the treating of this disease, and we are hoping to do a little better in the management of this disease. Overall, pancreatic cancer is a serious diagnosis, but you need to have the actual diagnosis and the staging in the context, and you need to think about the staging and whether you're a candidate for surgery or not. This is very important because if you're able to undergo surgery, the prognosis is much better, and you would have more chances of survival if you have pancreatic cancer. Pancreatic cancer, when I think about it, usually I divide every patient disease in three categories. First category is that if the patient is able to undergo surgery, and I call it a resectable disease. Usually the surgery is a very extensive surgery, and it involves resection of the tumor and taking out part of the stomach, and it's called a Whipple procedure. And it has some mortality related to the surgery, but overall I think it's the best option for any patient who has pancreatic cancer and needs to undergo this surgery. The second category that I usually think about is the fact that a patient has a non-resectable disease. They cannot do surgery, but it's just localized and hasn't spread to the other areas. And usually I start these patients on chemotherapy treatments, and then we would try to get some focal radiation treatments to help to control the disease and make sure it doesn't grow and spread to the other areas. And the third category is like a widely metastatic disease, and the main treatment of that would be chemotherapy treatments. The chemotherapy treatments for pancreatic cancer is somewhat limited at this point, but there are a lot of research going on, and hopefully we can have new drugs expanding our chemotherapy options for this disease. One of the things I'd like to share with you today is the fact that having pancreatic cancer is sometimes not a death sentence, and often a patient, when they get diagnosed with this disease, they always given a time frame of 6 months to live, which I think is a very inaccurate time to say. Every individual is different, and every person's disease is different. And you need to think about the stage of the disease and where the cancer has involvement, and then think about the treatment options. And when somebody gives a 6 months period of lifespan is a very unfair thing to say, in my opinion, because that's usually an average of a patient's life that they have seen in the clinical studies. And that means that there might be a patient who lived 1 month, and then there might be another patient who lived 12 months, and then when they add them up, then they come up within an average of 6 months life. The overall survival of patients who undergo surgery is usually better, and I have about 30% of the patients surviving more than 5 years when they have surgery and early stage disease. For an unresectable disease but not spread to the other areas, usually the treatment is chemotherapy treatment, and I follow it with the radiation treatments. And sometimes we do a very focused radiation called cyberknife radiation to really ablate the tumor. And patients tolerate these treatments fairly well, and they have a good quality of life, and usually more than 6 months of survival. And actually, I think our average is about 12 months, 12 to 18 months of survival with unresectable disease. Overall, when somebody is diagnosed with pancreatic cancer, my advice to them is don't give up hope. There is always hope for a cure. I have patients that I have survived more than 5 years, and I consider them cured. Actually, one of them is an Iranian gentleman that has been working in oil fields in Iran, and he thinks that he got pancreatic cancer because of that. And he had surgery many years ago, and he's doing, knock on the wood, very well right now. And I have patients that are doing well despite having like a stage 4 metastatic disease, and they're having a good quality of life, and they're enjoying their life. So it's very important not to give up your hope. There is new clinical studies and new medications are on horizon, and just don't give up hope. And we try from our side to do our best to get these treatments on the road and enroll patients on the clinical studies.